Nursing students, this patient comes into the ER and within 20 minutes, you're calling a rapid response. What happened? This is an NCLEX case study. I'm going to give you a presentation, vitals, labs. You are going to guess the most likely diagnosis and answer 4 questions based on that diagnosis. This is a 62-year-old Hispanic male who presents to the ER with a history of alcoholism, cirrhosis, and worsening ascites. Suddenly, he starts having hematemesis. The only thing you were able to do in that 20 minutes was to get a quick set of vitals. Not looking great. His blood pressure is 86/48, heart rate is 128, and his SpO2 on room air is 93%. You sent off a quick H&H. His hemoglobin is 7.1. His hematocrit is 22%. Based on he's now vomiting blood and his history and his vitals and his labs, what is the most likely diagnosis? You have 3 seconds to answer. 3, 2, 1. This is most likely a ruptured esophageal varices. So when patients have cirrhosis, they get portal hypertension. That is going to back up blood flow into the little vessels of the esophagus, and these can rupture. The patient will all of a sudden have hematemesis, and it is very, very scary, and you need to call a rapid. What is the emergent thing that you need to do for this patient as soon as you think, oh gosh, he's got ruptured esophageal varices, which is scary? You have 3 seconds to answer. 3, 2, 1. You are going to make sure that the patient is sitting upright because they are vomiting copious amounts of blood, and make sure you keep that airway open. You may need to suction, apply oxygen, but you have got to keep the airway open because this is like exorcism level vomiting blood, and it is extremely scary. And they are going to need surgery. Okay, we're going to put bands on, but in the meantime, you are going to anticipate starting this kind of tube in the patient. What is this tube that we use for an esophageal varices when we cannot control the bleed? You have 3 seconds to answer. This is a wild name. 3, 2, 1. This is called a Sing, Steak, and Blakemore tube, or they may call it a balloon tamponade. So how it works is we are going to put it into the patient here. There's going to be a balloon that is going to put pressure on that ruptured esophageal varices, and they have a gastric balloon in here as well, and that's going to make sure that it stays in place. Now, this is only meant to be short term until we get them into surgery. What drug do we typically give for ruptured esophageal varices? You have 3 seconds to answer. 3, 2, 1. We are going to give octreotide, which will help to manage the bleed. And last question. Since this patient is bleeding pretty intensely, what blood products do you anticipate giving? You have 3 seconds to answer. 3, 2, 1. We are going to give either packed red blood cells, platelets, and or FFP, fresh frozen plasma. But at this point, when you assume they have this, we've already called a rapid. Tons of people are coming in there to help you. You're going to be doing all of these things in order to get the patient stable to get into surgery. How'd you do on this case study?